topic. Okay, this started. Thank you very much. So will you please, Dr. Briganti, present yourself a little bit and let us know where you're working right now. Thank you very much for accepting this discussion.
Of course, thank you very much. I am Dr. Giovanni Briganti. I am a psychiatrist in training in the Brussels-based University Hospital. I am an expert in artificial intelligence since that is the subject of my PhD thesis that I recently passed at the University of Mons. I'm specialized in Bayesian artificial intelligence, that is retrieving what symptom causes what symptom in mental disorders. And that's why I acquired an expertise in artificial intelligence, and that is why I lead on a Belgian government level the initiative for AI in medicine, which is called AI for Health, which belongs in the broader initiative for AI in Belgium, which is called AI for Belgium.
Okay, AI. Okay, very interesting. Thank you very much. So you will explain, please, for us, for those who does not know, especially have never heard about it, how AI can be used in psychiatry.
Okay, in psychiatry and in a larger perspective in medicine, AI is creating a specific framework, which is augmented medicine. Augmented medicine is a mix of different techniques that are enabled by AI, which can help doctors better prevent, predict, diagnose and treat disorders as a whole, as well as offer different options for a follow-up with the patient. That is, we are now able to different tools to outsource several procedures that are normally done in the hospitals. That is, taking the parameters of the patient, taking the history, establishing a differential diagnosis. So all of that can be outsourced, for instance, nowadays. Second of all, diagnostic tools enable doctors to base themselves on data that comes from, for instance, history taking or medical examinations such as radiography, CT scans, MRI, and suggest a diagnosis. This is very important because it eases the doctor's job, and nowadays we know that we do not have enough doctors to go on with the important charge that is placed upon them, and this COVID-19 pandemic is a clear example of it. Predicting, preventing, and diagnosing diseases is a very important step that is enabled nowadays by AI. The second important part is that we can now shift towards a predictive medicine because AI enables, for instance, genetic analysis and genetic prediction, and can really profile the patient in a better way. A third way that AI can be used in helping doctors is, for instance, the clinical decision support. And those systems are embedded in the EHR, the electronic health record for the patient, and can base ourselves with machine learning on the patient data to extract what are the meaningful clinical information that can be of use to the doctor to treat the patient in a specific setting. So these are just three great domains of augmented medicine, but AI is carried on to other fields as well. That is surgery, such as surgical navigation tools, such as telemedicine, such as virtual reality, the reality virtuality continuum, and so on, which make for a global framework for the use of digital tools.
So you mentioned that this can be used. Is it the potential, or it's already used, all of these for prevention? As an example, I heard that there are some softwares who may predict what type of patients may suffer from a severe form of COVID. Do you use it in your patient management at the hospital, or it's just a potential, or it's not used that much everywhere?
So Europe has a specific situation because we do not yet have a framework for using AI software in Europe. So the initiatives for using a single AI software for a specific clinical problem depends on the hospitals. And that is, there are certain hospitals that use AI tools for a specific clinical situation. which may vary from diagnostic radiology to histopathology and to appointment taking, but those rely on individual hospitals. So that we do not have in Europe a centralized strategy for AI in hospitals.
Okay, so it's,
However,
yeah,
yeah,
it's
however, there are
interesting. Yeah.
other situations in the world. For instance, in the US, where the main societies developing this software rely, we have hospitals that do have a deal with those societies, and those hospitals can benefit from an advanced, advanced tools that can be deployed in clinical practice. Yeah.
Mhm. Okay, that's very interesting. You mentioned that it all depends on the hospital itself. So does it mean that it depends on the business model of the hospital, or it's the management mentality of the hospital, or does it related also to ethical issues and regulations?
Yes, so it mainly depends on regulation.
Okay.
That is, we do not have a centralized framework for using AI in hospitals in Europe, and that is what is holding us back from deploying AI software. That is the main point that I would like to make, is that the same problem does not happen in the US and in China, of course, where AI software is deployed as it is being made. In Europe, whether the hospital is private or public, there are limitations. For instance, in Belgium, the the professional order of doctors does not yet allow digital medicine as it unfolding in other states. And for instance, the only tool and framework that is allowed nowadays is teleconsultation, which was mandatory for overcoming the COVID-19 pandemic.
Mhm. Okay, what about those softwares that are created to track COVID, that you can just use it by your telephone? It was not very successful. The first one was a catastrophe in France. The second one is better tolerated by people, but even the second one is not very much followed by the people. Even if you receive, a message from the government that, encourage you to install the software because I do not know, the shops are open right now and you have to be able to track wherever you go. So what about Belgium? Are you using the same software, and how is this received in the society?
So we are quite lucky in Europe because the application, the software is practically the same in most member states, which are all based mainly on the German version of the application, and the code is openly available on GitHub. The main problem with those applications is that, well, in Belgium there is quite a success. We have almost half of the population that has downloaded the application, but one of the main problems is that it is not strictly speaking AI, which powers the application. So it's most of a Bluetooth technology, so the GP2T protocol, and that is problem because AI tools would have been able to enable a tracking which would have been more efficient. For instance, backwards tracking, and being able to have a live feed of monitoring the people that do not even need to use the application or download the application.
Mhm.
Of course, such applications demand a clear, ethical, and governmental monitoring, because, well, that is too much power to have
Sure.
for any entity on European field, but it is applied in other countries. Yeah.
Where it is, I think, is it one of the reasons that the pandemic is very well managed in China, in Singapore, and in many other, because they didn't see the second wave. In the news, I was listening to a discussion, and there is no second wave in China, neither in Singapore or any other, the region around China. So they are safer than us. So do you think that's one of the reasons that it's better managed?
I guess that it is, but one of the other consequences is that, well, those countries have pretty much invaded the personal space and the privacy of their users and their citizens, and I think that was a debate that we needed to have and that was killed almost immediately in Europe. So we all went towards the Bluetooth technology and the GPT-3 protocol because we did not have a choice. The debate was just non-existent. So that's I think a major point, but we may never know what would have happened in Europe, but I guess the situation would have resembled in as the one in China and Singapore and so on.
Okay, so I changed the questions a little bit. I returned to the first question I asked you about the increasing number of the patients due to COVID in psychiatric services, and you were telling me something when I just started to record it. Yeah, what did you want to say? Is there any increase in the number of those patients due to COVID situation?
So yes, we in an overall kind of way, we observe that patients consult more and more psychiatrists in Belgium because of anxiety and depression symptoms due to lockdown, but also we have an increasing number of psychosis and bipolar disorders that become more and more severe and that require civil commitment. So forced hospitalization, that is my area of expertise. And people that did not have a mental disorder before happen to develop severe forms of mental disorders, such as, like, once again, schizophrenia, psychosis, and bipolar disorders due to lockdown measures.
What about those patients who were sick before COVID? Is there any change in their state of mind, or what was the effect of COVID on their situation?
So we were not able to consult patients before
Oh, yes, during the
teleconsultation
lockdown.
became official. So we had a number of rehospitalization due to a lack of teleconsultation, but that was corrected after teleconsultation. But yes, stable patient tended to decompensate and develop new episodes of severe forms of the mental illness. Yeah.
Okay, but what about those mental health patients with COVID? Did you identify anything about do they take, are they infected by COVID? Yes, more than the others, or less than the others? Because in France, in one of the hospitals, they had a great discovery. I will talk about it. Maybe you have heard about this, that they discovered after long observations that those patients who are taking some of psychiatric treatments, especially against depression, so they stay safe. And so there is no problem. They have no problem with COVID because then they did a research about 16 drugs that are prescribed in psychiatric services, and their findings are published on PubMed. That some of these drugs can protect them, and because they have an impact on their immune system, so it makes them more resistant to infection because of the COVID. And it was it was a great discovery about the drug repurposing of psychiatric medicines to prevent those patients to have COVID. Did you observe such change or such a phenomenon in your service?
So during the first wave, we had a specialized unit for psychiatric patients that had COVID-19. But during this second wave, we do not have any psychiatric patient with COVID-19. But one of the reasons is that I guess the measures psychiatric patients tend to isolate themselves more than maybe normal patients. I think that's one important factor to consider. But also the opposite may be true in some diseases such as mania. Manic patients may tend to go out more because of their expansive humor and mood. So I guess that the second wave, we have less COVID-19 psychiatric patients, and that's a good thing.
Yeah. And they observed that, even if they have prepared, a whole part of a service, for those patients, psychiatric patients with COVID, and it stayed empty. They didn't have almost any patient, with with post diagnosis, and that was what made them to study and discover what has happened, because they at the beginning they were thinking that these patients maybe they are more fragile than the others, and they were really worried about them, and then they discovered, no, maybe it's something to do with the medications they are taking, that can protect them. And definitely, they when they did that research, they discovered, yes, some of them have an impact on the immune system and make them more resistant. And it is, those medications are entered in the list of the drug repurposing for COVID and are used now. That was great. I think it was a very good news, I think.
I guess it is, yeah.
Yeah, it is. So let me see. I read several articles these days and during the previous months that AI is reshaping the healthcare during the COVID and beyond. Do you believe it? Do you think that it's COVID has been an opportunity for AI to encourage more professionals and non-professionals for the use of AI in medicine to use augmented medicine, as you mentioned it? Do you think that it was an opportunity?
I think COVID-19 was the biggest push towards the adoption of AI in medicine and towards the kickstart of digital
Mhm.
medicine throughout the world. I think just as an example, telemedicine wasn't even thinkable last year, but was possible today because of COVID-19. I think the rest of the implementation of clinical tools that use AI will come in time. And thanks to, well, also thanks to this COVID-19 pandemic, I think that professional holders or doctors are starting to realize that adopting AI in healthcare isn't so bad. And are starting to get interested, and that's something that I can observe because I'm getting more and more invited to give talks about AI in medicine. And we need to, well, the thing is that getting interested is one thing, and developing software that can be used in no matter what hospitals that buys the software is another step, but we are quite far from that step yet. We need
In
to
Europe,
develop more stable
in Europe,
technology. Yeah.
yeah, in
But even
Europe.
in the US, well, most studies that use AI do not have a reliable methodology, do not have a primary application. So all those points need to be addressed now that the public is getting interested, and the public meaning doctors. We need to produce more stable medical AI science to support more stable medical AI solutions.
Hmm. Beyond teleconsultation with doctors, that I suppose that some of the patients, they cannot do this because of some of the problems, or they cannot trust this still, so they need to be educated. I think all of and it's not only for the elder patients, it is also that's the same for, or let's see about how to see a dentist when you cannot show your mouth, and he cannot do anything when you are suffering from a tooth problem. So beyond that, what can be done? What's used nowadays during COVID as AI in medicine? So
So
teleconsultation, what else?
one clear example that I can give is that the National Initiative for Medical Applications in Belgium has validated a questionnaire that patient can use at home and can be transmitted to the doctor, to a healthcare practitioner for predicting the risk of COVID-19. And I think that's one great example of what can be achieved. We are quite we're quite far yet from what is called continuous medical monitoring, and I think we will not adopt those tools until in the next decade. But yes, a first step is a structured history taking for assessing risk, and that is used in quite a number of countries, including Belgium nowadays.
Mhm. Great. For the prevention, because you also mentioned that AI can be used for not only for diagnosis, but also for prevention. Do you think that AI could be used to prevent the pandemic or could predict the exact time, the arrival of the pandemic? Or let's say, do we have enough data to have this prediction for the next pandemics?
Well, some AI enthusiasts like to say on television that AI can predict the next pandemics. As a technician, so someone who works with AI and algorithms every day. I tend to be more careful and conservative about such statements. But I certainly guess that there will be a big spot for real time monitoring and live feedings concerning the spread of pathogens. And I think those tools that are enabled with AI can certainly help. But once again, it requires great massive amounts of data and a really good infrastructure to work.
Okay, okay. So nowadays, you listen. It is the discussion everywhere is about the vaccination, the arrival of the vaccination. Do you think that many people are really worried? I do not know. Maybe you have heard it in France. People are really pessimistic towards vaccination. In UK, no, people are rather happy to be vaccinated. It starts from tomorrow. So, what about Belgium? Do you think that it's the arrival of the vaccines is a good news for people? They're happy, or
I love Belgium for it is quite a country without vaccine hesitancy, which is quite the home in France. On the contrary, so I guess many people and many people hope for the vaccine to come so that they can start a normal life again. I guess that's a good thing about Belgium. We don't sense that much vaccine hesitancy as in France, so
no,
that's a good thing.
it's about the technology, that people are afraid because, the greatest scientific in France told us last week that we don't know anything. We do not have any scientific data about this new technology and what are the consequences. We do not have anything really, no scientific paper, nothing. So that made the other professor to say that, so we will hesitate to be vaccinated before receiving full information about these new vaccines. Both of them are rather new technologies that have never been used, on human beings. So I think there is room to be a little bit worried, so what will happen? And also there is no guarantee that they will protect us for several months, or I do not know, at least 1 year, we do not know. And so there are lots of questions around this. My question, as we talked about the augmented medicine and the role of the AI, do you think that AI can be used to assure people, or to predict the results or the risks, is if there is any?
So yes, AI can be used, and it is used by pharmaceutical companies nowadays to select the best molecules and to try test them in virtual patients before conducting the experiments on humans. That's called in silico clinical trials, and that's a very promising area for the development of AI, because we build human models within the machine, and we test the virtual molecule on the machine. That is also a very economic choice for development of drugs, and a safe choice before testing the drugs on patients. So that's a promising area.
Okay, and is it used by the vaccine companies? I have heard that they have created applications to follow those patients, volunteer patients, or non-patients who have been injected the vaccine twice. So, and they are following them, by these applications. They enter their data almost every day to know how it is, how they are reacting to this new technology, their body. So I think it's already done by the vaccine companies, but I do not know at greater social level how AI can be used, to give some guarantee to people, you know, that don't be afraid of that, you know. Do you think that more transparency probably for sharing data or the results can help us to understand better? And if people understand it better, probably they can trust.
So there are two several questions in your questions. That is the first, can AI help in reassuring people? I guess that AI has no role in that matter, not yet, because AI it's most useful to, you know, pharmaceutical companies and to gather to process the data. The second thing is that yes, of course, we need transparency and we need open data and we need open protocols to to ensure that we get the trust we need to go on with vaccination. And but that is quite complicated if AI is involved. That is, nowadays the number of explainable AIs, that is the AI that can actually be explained without a black box process, is kind of difficult to find. And they certainly do not concern the domain of vaccination. They are more present in the domain of machine learning, of predicting risks based on the patient's file and the patient model.
Mm-hmm. For you, in your job and in your research area, what do you wish to see that may happen in the upcoming weeks or months, you know, that may facilitate the use and access to AI in augmented medicine, and
So
how this
we,
can be accelerated?
of course, well, to adopt AI, we need a legal framework. So I know that the high level expert group on AI, European Commission, is working actively on that. And I think that's the biggest thing we need is a legal framework to use and adopt AI in healthcare settings. To push forward the adoption, however, we need the software. And the software, there are two main barriers. As I said, the first is the methodology. We need more transparent methodology with more reliable design. And that can be achieved only if societies partner up with universities and world-renowned scientists to develop good software. And the second thing is pricing. So we need national consortia and national initiatives towards ensuring that hospitals can get the software they need for a good price. And maybe a good way of starting that is that enabling hospitals to co-develop solutions with universities and with societies, so they can have a great discount on the final solution, or have a free solution because they help developing it. So that's another quite important step.
That's very interesting what you mentioned to collaboration, because a lot of this success, you know, this accelerated success of the vaccine, it was due to collaboration during COVID between different countries, different hospitals, and different research centers and companies. What are your recommendations for France, Belgium, and other European states to accelerate, you know, the regulations and facilitate the access to methodologies, to improve the methodologies? What can be done?
So, first, establish a national network of experts that can assess such technologies. Second, educate future experts, and that means creating and adapting the medical curriculum on AI. And third, creating a legal framework for adopting AI, as I said before. And last but not least, creating an economic environment for adopting AI.
Investments.
Yes, investments. And I guess that all hospitals need not have any AI solution. I think that with a more compact and more structured network of hospitals, I think that AI resources should be divide and conquer, to ensure that a given hospital that is specialized in cancer has AI software for cancer, and so on. So I guess that we do not need to have 3,000 applications for each hospital. I think we need to select and deploy the software that is needed for clinical applications.
Okay, so I stopped the recording. Thank you very much, because I can see that you're a little bit, maybe more than a little bit tired. I understand,
Oh
believe.
no, it's okay.
No, no,
It's
no.
really fine.
That was, I suppose that we quickly we reviewed all of the important questions. I do not know if you want to add something, or is there something important that you want to talk about it, you know, to share it with professionals about what you do, what you intend to do, how other professionals can do it better in their jobs.
No,
Okay, okay, that's very interesting, very important. Thank you very much. I think the message is very important. There are several messages that you transferred. I will try to put it in on YouTube tonight. I will
okay,
send you the copy. You can share it.
okay.
Yes, and what was I? And I will personally, I have cut the. This is not. This part of conversation is not recorded. Are you personally satisfied? Because here people discuss, you know, they are not satisfied of the management of the COVID disease at the hospital levels. You know, they're complaining a lot. You know, so are you satisfied of what you see around you?
I guess that with the media and population that we have, our politicians could not have